Hello, my name is Sam Feltham, and welcome to Expert Interviews here on Smash the Fat. With me today is quite possibly the world's leading low-carb physician, Dr. Eric Westman. How you doing, Dr. Westman?
Doing great. Great to be
Fantastic.
with you.
Yeah, absolutely. It's fantastic to have you here. As I alluded to there, you are quite possibly the world's leading physician that is advising and treating patients with low-carb ketogenic diets at the Duke Lifestyle Medical Center. That's in North Carolina, is it?
Yes, that's right.
Awesome. So let's start off with how exactly did you get into this low carb world?
Well, first I should say that I am working. Maybe I might be one of the world's leading doctors, but there are many others who've come before me, and I've used their experience and learned a lot from practicing doctors and from the science. But when I go back 15 years ago, I was in a clinic myself as an internal medicine doctor, and two of my patients did this strange diet that all they did was they ate steak and they ate eggs, and they lost all this weight, and as I was very skeptical about it. And a lot of doctors are where I was 15 years ago today. They're still very skeptical, but I was curious enough to at least read the books that they had read, and after reading the books, I thought this can't be good for your blood cholesterol because you're eating all this fat, like all the doctors think today still, many of them anyway. And I don't know what it was, but I wrote a letter to Dr. Atkins, who had the biggest diet book, low-carb diet book at that time, and really, I guess, of all time. And he still had a clinic in New York City. He called me on the phone after I wrote him a letter, and one thing led to another. He said, well, you're just going to have to come visit my clinic. So I got into this out of curiosity, having seen some of my patients do it, and I checked the cholesterol levels of these two patients, and it was better. So in fact, one of the patients kind of shamed me into it. I mean, he said, you're a doctor, why don't you check my cholesterol if you think it's bad? And rather than know what the answer would be, which a lot of doctors do that. They assume they know what the result will be. I actually checked the blood, and in both cases, the cholesterol levels got better, even though everyone else said that it would get worse. So it was really out of curiosity that I got into this. I don't have any major weight loss story myself, although as an internal medicine specialist, it became apparent to me 15 years ago that obesity and diabetes were on the rise, and the medical world with medicines really didn't have an answer for it. So I asked Dr. Atkins for some money to do research down here at Duke, and they said yes. We did a study. We went back and showed them the results and said, you need to do another study. So we did a single-arm non-randomized study, and then we went back and said, you need to do a randomized control trial, and they said, okay. And so those were publications back in 2002 and 2004, and now over the last 10 years, there have been research studies all over the world basically saying the same thing, that a low-carbohydrate diet is a healthy thing to do. In fact, it's therapeutic for obesity, diabetes, high blood pressure, heartburn, fatty liver, the list goes on and on.
Absolutely. It's been quite a journey for you over the past 15 years. And part of that is collaborating with probably the world's leading low-carb blogger, Jimmy Moore, with your first book, Cholesterol Clarity, which kind of goes into the basic science of why cholesterol profiles improve on a low carb, high fat diet, and what you kind of need to look out for, and maybe what your doctor should start to look out for. People can get that via Amazon or at smashthefat.com/cholesterol. And then your second book, which is coming out next month, Keto Clarity, which goes into a bit more about the diet itself and its therapeutic applications, as he said there, and people can pre-order that via Amazon, again at smashthefat.com/keto. Now, over the past kind of 15 years, there have been a lot of at least half decent randomized trials, randomized controlled trials, that have kind of shown the therapeutic applications for this. But despite all of this, there are still quite a lot of low carb myths that are kind of out there, still floating about, still getting promoted by doctors, journalists, and things like that. So what are kind of the first barriers that you kind of face when you start talking about low carb diets?
Yeah, so it kind of depends on the training or where other people have learned the information. Here in the U.S., the government got involved in making guidelines in the 1970s and turned us all against eating fat. And so the fear of eating fat is probably still the most pervasive element of a myth that's out there. But it's just starting to change in the pop culture this year, which is great. But as I presented the research through the years, the dietitians were the first ones to say, you know, this can't work. You know, we're in charge of the nutrition, and you know, who are you, doctors? But you know, doctors, if they really are treating the whole individual, have to be concerned with the fuel and nutrition that goes in the body. I mean, but a lot of doctors just don't understand nutrition. Kind of like doctors turn off their brains when you talk about teeth, because that's the dentist's area, right? So yeah. Teeth really connected to the body, you know. A lot of medical doctors won't know how to handle tooth problems. It's the same with nutrition. But so the dietitian said, if you don't talk about calories, it can't work. And so the first thing that we showed in good studies was that you could teach carbohydrate restriction, limiting carbohydrates, not even mentioning calories, and people would lose weight. Now, it's not that calories don't matter, it's just that you don't have to talk about them. Mm-hmm. So what happens is people have a reduction in hunger, they eat less than they did before, and they start losing weight. So the dietitians still today will, oh, there's only one way to do it, and that's calorie restriction and fat restriction. And so in the U.S. still, and I think in the U.K. as well, the traditionally trained dietitian is going to still just be a low-fat, low-calorie, one-size-fits-all sort of practitioner. Although there are a few open-minded folks around the world, most are still going to be skeptical. But we did show that you didn't have to really talk about calories, and it would still work for weight loss. One of the next issues that still is out there, and which was one of the reasons we did the cholesterol clarity book, was the concern about the blood fats and blood cholesterol getting worse. And fortunately, over the last 10 years, there's been a shift in thinking in the mainstream that it's not just the LDL cholesterol that matters, it's also the triglycerides and the HDL cholesterol. And for the viewers who don't understand all this, Jimmy Moore did a great job. One of his strengths is to write in a way that most people can understand, and so that's what the clarity idea of the titles of the books. And so we pretty much explain what LDL, the lousy cholesterol, the bad one is, and the HDL, the healthy or the good cholesterol. But then it gets more complicated because there's a good bad and a bad, and there's a bad good and a good. So it's ever more complicated. And at the end of the day, the diet is more important than drug therapy for cholesterol. You know, that's one of the main themes of the book, is that the carbohydrates cause inflammation, and it's the limiting of carbohydrates is more effective than taking a drug for a diet where you have carbohydrates in it. So, and that's another main theme that I've learned as an internal medicine doctor, is that nutrition is much more powerful than any medications or even 10 medicines we have today. And often the main medical doctors are treating the diet-related diseases with medications without going to the root cause, which is changing the diet. So the other myths that we run into is, well, no one can do a low-carb diet for very long. So why would I teach it? And then, it really kind of took me standing up on a podium saying, well, I've done it for 5 years and then 6 years and now 12 years, and so at least one person can,
Yeah.
So it's almost like you have to show the exception because no one can do that. Well, yes, and then there's support groups. Even 10 years ago, there were support groups where there were 100,000 members doing low-carb diets who were all together. So we surveyed the, let's see, I think it was the Low Carbers Forum at the time, and asked people how long they'd been on the diets and yeah, people could stay on it. So that's a myth that it still is out there. Well, okay, it works, but I can't get anyone to do it. Well, so now that we get into the problem of teaching it properly, and that's changed a lot. Getting the proper books. We have a country music singer in the U.S. His name is Chet Atkins, and when people do the diet wrong, it's actually Bob Atkins or Robert Atkins. We say that they're doing the Chet Atkins diet because they didn't do it right. But so teaching it correctly, getting great resources that are evidence-based have changed a lot. So I'll have people who did Atkins or low-carb ketogenic diet, the first phase of Atkins, 10 years ago, and it worked well for them, and then they kind of lost track and stopped doing it, and a lot of people did it here in the States 2003, 2004, and so it's coming back into more of a popular thing to do, although the names changed. So the paleo and primal and gluten-free and all these other names are really just different formulations, different variations on the theme, if you will, of low-carbohydrate diets. But those were the main. Well, and then I guess the classic one is it's fat in the food, fat on the artery. Duh.
Yeah.
Right. So,
I think there's that kind of linear sort of causation there, don't they? I think it's sort of just like your kitchen pipes, clogs up the sides, and whoosh, that's it.
Well, the marketing people did such a great job of convincing us of all of this that's wrong. Basically, an entire generation of doctors, dietitians, and general public was taught the wrong thing. They were taught based on a prediction, and I know the studies predicting what would happen on this kind of diet, and it looked bad. But when the studies were actually done, it didn't happen. So it's kind of like that you predict the end of the world, and the time passes. Well, the end of the world didn't happen, and we get over it, but we don't get over the bad teaching of a generation of people very fast. So it's a paradigm shift, which means a worldview is changing, at least in the scientific dietitian medical community, and that still, I'm faced with people who are at various levels of skepticism, and these different myths are out there. Most doctors I convince by sharing patients with them. So, they have trouble with the diabetes or the obesity, they send them to me, and I fix them, send them back. But that's a slow process because they imagine you're in their clinic, and oh well, Dr. Westman's patient did well, but then they don't see another of my patients for 3 months or 6 months, and they can blow it off as something that's random or it doesn't happen all the time. But the other thing that I'm doing now is having doctors and interested health practitioners come shadow me in my clinic so that they can see it in action. And thinking back, that's really what made me get interested into doing the research, is that I saw Dr. Atkins' clinic in action, looking over the shoulder of practitioners there. Jackie Eberstein, who's a nurse that worked with him for 30 years, let me see some patients with her, and that was very helpful to get through all of these different layers of myths that occur. Now, the last one that still defies explanation is that the low-carb diet hurts the kidneys. And
Mm.
I finally realized what prejudice and discrimination is, because there's no evidence that that happens, and yet everyone knows it to be true. In fact, it's harder to dispel a myth that has no basis in fact, because you can't find the facts to dispute. So it's a belief. So not only is there no evidence that it harms, what we're talking about is a high-fat diet, not a high-protein diet. So when people are saying, well, your diet harms the kidneys, it's high protein, I have to explain, no, it's really not high protein, it's high fat. Well, and then that gets down the pathway of, well, doesn't fat hurt the arteries? And so anyway, it's sort of one myth can be debunked, and then another one is the rise up. And it's like the little whack-a-mole game. Have you ever seen that, where you try to mole, another one comes up? But I think the best study, long-term randomized trial that I'm aware of is the study that was done in Israel by Iris Shai and the workplace diet trial, and out to 2 years with endpoints of carotid artery thickness, so the neck artery thickness. There was a reduction in the thickness of the arteries, which was a good thing. Actually, independent of the diet, all the diets they studied had that positive effect. So even so today I'll stand up and say, well, I've done this 15 years now. There'll be a hush or
shock horror, because it's just totally bizarre. Because I mean, as we were kind of talking about before we came on the air here, I'm going to be doing this talk at FitPro Live, which is this kind of fitness industry convention, and I've kind of picked out 15 of what are the best randomized controlled trials that I know of, to the best of my knowledge, and they all show pretty much exactly the same thing. Low carb ad libitum diets, as you were saying earlier. You don't have to tell people to restrict calories, you just tell them to restrict carbohydrates and go towards real foods as much as they can, and then they tend to bring the quantity down on their own because they're starting to use their stored up energy for energy throughout the day, because it's kind of being liberated in that way, is kind of my way of explaining it. But despite all of that, there is still people out there just sort of saying, no, this is not the way forward at all. And one of the things that they start to talk about as well is gallbladder as well, and about sort of stones and things like that.
So eating fat helps the gallbladder contract or squeeze, and so it helps emptying it out. So it can be mistakenly thought of as the cause for the problem, because a stone may have been there before, and then because you're starting to eat fat, you actually squeeze the gallbladder, and the stone might come out, but it isn't what caused the stone. So sometimes that's a fallacy that because you see it after something happens, you think it's a result of it. Post hoc ergo propter hoc fallacy, and that you really need science to shed light on that. For example, another relatively common thing among people with obesity is to have kidney stones, and so there's a study a long time ago that said the higher fat, low carb diets increased the likelihood of increased the environment for a kidney stone. It was a very short study, but in our randomized trials that have looked at low carb versus other methods, the rate of kidney stones is the same, other methods of weight loss. So until you get those comparison groups side by side, and ideally with randomization, we really don't have great evidence. And the sad reality is there's not great evidence for any diet. I mean, so I'll hear people, cardiologists, proclaim how the Mediterranean diet is so wonderful. And there are only 2 randomized trials of the Mediterranean diet in heart disease, and they're both done in Europe, which has all the other lifestyle differences than we have in America. So, and yet American doctors are saying Mediterranean diet is best. So I don't think we know the ideal diet, and hopefully we'll be able to tailor that, individualize that. But I'm pretty convinced that the high sugar, high carb diet is not the best diet for most people. I'm convinced of that.
Undoubtedly, undoubtedly, that's it's very, very true. And kind of reading the back sleeve of Keto Clarity, the therapeutic applications for it include epilepsy, type 2 diabetes, obesity, cardiovascular disease, metabolic syndrome, polycystic ovary syndrome as well, irritable bowel syndrome, heartburn, Alzheimer's disease, mental illnesses, including depression, and quite a few other things as well. And one of the sort of things is that what I see this as doing, a ketogenic diet, at the beginning, is it kind of brings you back into what I call biochemical balance. So it kind of brings balance back into the body, because you've got possibly excessive insulin secretion, possibly excessive leptin secretion, and lots of other things going on, including cortisol as well, all over the place. And yeah, this brings it back into biochemical balance.
Right.
And can you explain sort of how that kind of happens with a ketogenic diet?
Yeah, well, so I like all the things you've mentioned and how you're explaining it. And another way that I am starting to teach is that really you're starting to access your body fat stores. You're becoming a fat burning machine. So, and you'll start seeing that percolating through. In fact, in the new Atkins book that we wrote, Steve Finney, Jeff Volek, and I wrote, we have fat as your friend as one of the chapter titles in what you eat. So, but you want to access, we store energy as fat. So you have to get your body into a fat burning mode to get to your stored energy. So every time you eat a carbohydrate, you stop the fat burning. So, just as a simple teaching tool, if you want to be a fat burning machine to get access to your fat store or your battery pack, whatever you want to call it, then anytime you eat a carbohydrate, you set your body away from fat burning, which is what you're trying to do. And to describe the metabolism is difficult because it's very complicated, although the sugar burning, fat burning kind of gives you the crude differences of things that are going on. The other main difference is inflammation. So the carbohydrates are now well known to be causing inflammation, which is kind of like just gumming up the works. Your body has to fight inflammation, and we suspect that there are a lot of diseases that we don't know the cause yet, but they're inflammatory diseases, and they're probably related to carbohydrates. But we don't have the solid science for that yet. And individuals will come to me already on a ketogenic diet for specific disease and say that they're better as a result of it. So I'm still learning about how this metabolic change can affect the chronic illnesses today. Epilepsy was one of the first tools, or one of the first diseases treated with this tool, the ketogenic diet. And I think it was first described in the Bible that if you just didn't let someone eat, their epilepsy would get better. And the not eating is the same fat-burning metabolism as you have on a low-carb ketogenic diet, except you're eating protein, but you're still in that fat-burning mode. But so if anyone wonders if the diet can affect the brain, yes, the children who have epilepsy, hundreds of seizures a day, can change to this way of eating, and the seizures will be gone the next day. So the brain is quite responsive to a shift in the fuel source, the metabolism. It turns out the brain likes ketones a lot. And
yeah, because that's another thing that people kind of come up with, which tends to be quite a myth, is that the brain, its preferred fuel is glucose, and it can only run on glucose even.
Yeah, that's a myth that I tracked back to a world conference. World experts met and came up with this idea that the brain, when you're eating carbohydrates, the brain burns about 120 grams of carbohydrates a day of glucose. Therefore, you have to eat 120 grams of glucose or carbohydrate a day. So these world experts forgot or never knew that your body can make glucose itself, and the brain can actually run on ketones. They forgot those key biochemistry, physiology realities. So actually, even if your brain was burning 120 grams of glucose a day, your body, your liver, and your kidney can actually make that amount of glucose without eating any carbohydrate at all. So we put together just a letter to the editor to the American Journal of Clinical Nutrition, and one day I need to expand that into a full-blown paper. But basically, it said that carbohydrate is not a required nutrient or essential nutrient, so people don't have to eat carbohydrate because your body can make all the carbohydrate it needs internally. And yeah, the myth that you need carbohydrates to exercise is getting blown away. The exercise world is getting turned upside down because people going into races now already fat burning are finding that they're able to have more endurance being a fat burning machine than a carbohydrate burning machine going into the exercise. So that's been interesting to see.
Yeah, absolutely, absolutely, and that's kind of one of the things that I'll be touching on in my talk coming up this weekend, and sort of probably discussing with a lot of skeptics, I suspect, that are out there. But hopefully, I'll be able to provide sufficient evidence to at least try it.
Let me just give you when the skepticism is gone and people just believe what you say, it's not as fun.
No, yeah, that's true. That's true. It's nice. It's nice to have the debate a little bit, isn't it?
Yeah.
Yeah, and discuss and things like that for sure. For
But
sure.
you can expect some flack. That I think you can.
I expect so. I expect so for sure. Now we do have 2 questions from our viewers on the blog. So let me just bring those up. First up is from Patrick Rocken, who asks, what's the deal with long period of very low carbohydrate restriction and thyroid dysfunction and other symptoms like cold hands, feet, and dry eyes? Is there any way to avoid this?
Yeah, so I don't know much about this. It might be because my clinical experience and the clinical studies we've done haven't been long-term enough, or so I don't have people coming to me complaining of those symptoms. Mm-hmm. But I'm aware of people who say that by eating something called resistant starch, that they're able to get rid of those symptoms. There's just very little evidence to support how often that happens, and then whether the resistant starch is helpful yet. But I've heard a signal in that direction. But I have a bar of evidence that I require before that I'll accept something and spit it out as something that we should follow. Much like if I'm a doctor giving a drug, I want to be sure that I have a certain level of evidence to support the use of it and that it's safe and effective. So I don't know the answer to that one, but if someone had that and looked down the path of this idea of resistant starch.
Yeah, absolutely. That'd be really, really useful for sure. And then our second question is from Jasmine, who asks, is ketosis the answer to everyone who wants to lose weight, or can some, especially women having a hard time to lose weight, benefit from eating a little bit more carbs?
Well, so there are lots of ways to lose weight if that's what this person is trying to do. So you can restrict calories, and that works. There's often hunger associated with it, which makes it difficult for a lot of people to do. We estimate that about a third of the American population by genetics could do any type of diet, high carb, low calorie. The metabolism is not carbohydrate intolerant or insulin has a tendency toward insulin resistance. But that means 2/3 of the American genetic pool can't do those high carb, low calorie diets and do really well. So it's confusing because often the people for whom the higher carb approaches work have a different metabolism than you do, and so you have to be careful that someone could be proposing that this is the best way, it works for them, when your metabolism is very different. Also, if you're coming to low carb already exercising, already young and fit, you probably can have more carbohydrates and you dispose of them by burning them and you won't gain weight. You'll be able to lose weight easier. The people who come to me in my medical clinic are mostly women, mostly older after menopause, and mostly sedentary. So those are the three things that are stacked against being able to eat carbohydrates and still burn fat. But so the question is, can someone benefit by eating a little more carbohydrate? If you're really trying to get fat burning going, that you want ketosis. You want as much fat burning as you can. And I don't know, unless it's a food preference thing, why extra carbohydrate would be helpful.
Yeah, absolutely, absolutely. And yeah, it's something that needs to kind of be explored through randomized controlled trials, ideally in metabolic wards, to make sure we're controlling all the variables as much as possible. But again, at this time, the bar of evidence isn't quite there for anything like that, is it?
But I did like your N of 1 experiment. So you can control for lots of things if you use the same person, right? So yeah. I was pleased to learn about your experiment and to see the results, which really kind of made sense to me. So
yeah,
and in the way that merging together the low carb science and the high carb calorie balance science, I thought it hung together. You didn't make that up, did you?
No, yeah, there's no lying there. I can tell you. You can ask my girlfriend as well, because on both high carb diets, fake food and real food, I got rather bloated.
Yeah, well, that's the downside.
And on the high carb vegan diet, I can't remember how much. It was something stupid like 150 grams of fiber a day, or something like that. So it's a lot of fiber, and I was regular. But although towards the end, it was slowing down a little bit, so possibly too much fiber. So yeah, it's interesting. It's interesting.
Well, thanks for doing that. I'm sure you learned a lot personally, and clearly you enjoy teaching other folks about it. So that's fantastic.
Oh, absolutely, absolutely. It was an eye-opening experience that kind of just sort of showed what the randomized controlled trials are kind of saying. The more insulin secreting carbohydrates and more insulin resistant causing carbohydrates are going to cause you to gain more weight, basically, or store more calories or weight or energy, however you want to say it. That was kind of reflected in that second high carb, low fat real foods diet, where I kind of got 2/3 of my high carb fake foods weight, but obviously on the low carb, I was just over 1 kilo in terms of the gaining of the weight. So it just kind of just shows what we know about biochemistry, but for some reason a lot of government organizations are still ignoring that.
well, even people who are just trained in the old way of thinking,
they'll just stick to their guns, unfortunately. But yeah, I think things are really changing, and obviously that's kind of majorly down to yourself, Dr. Westman.
Wow.
with that initial kind of 6 months non-randomized trial, where you saw an improvement in people, and then you followed the evidence, and that's what quite a few other people have, like Chris Gardner and David Ludwig and people like that. So it's all props to you guys for keep on following the evidence and sort of seeing where it takes us in terms of being able to help more people and help people live healthier, happier lives.
Well, thank you for that. It really was just following data, and if, at a place like Duke University, we're trained to collect data and protect it, and just teach based on it, and to follow it, not to ignore it. But it's science in general needs to take into account new information rather than just ignore it. So science won't advance if you don't fund low-carb studies, if low-carb science has something else to say. And that's the situation we were in. You know, the paper in 2002 was the first paper since 1980 written on a low-carb diet.
Really? I did not realize that.
22-year vacuum or gap, and that one paper that was written had 20 people in it in 1980, and it kind of and the LDL cholesterol went up a little bit, and so they said it's going to cause heart disease, so don't do this. The evidence was just so weak by today's standards, but they knew what the result was going to be before they did the study. I'm sure it was done with the purpose to show that the diet was bad, which is not good. You want to have some equipoise, some belief that it could possibly come out a different way than you think it will. At least that's the scientific approach.
Absolutely. That's brilliant, Doc. Yeah, thank you so much again for your time today. And as I mentioned earlier, everybody can get a copy of Keto Clarity from next month if you pre-order on Amazon at smashthefat.com/keto. That's KETO. Then you can read more of Dr. Westman's thoughts on that. And is there any other way that people can kind of find out more information about you, Doc?
Well, there lots of things are changing. Now you can, like you showed on your website, there are books that are available and all. And actually, I'm considering working with a new company to get the word out in different ways. So that'll be exciting. Currently, that's not available yet, but hopefully, the science and now the pushback is not there because there's no evidence that this is bad. So I'm at that stage at medical meetings where I say, well, look, here's all the evidence that it's fine. Show me some evidence that it's bad. At a level of evidence that is at the similar to what I have, saying that it's good. And that's a quiet response because there is no evidence that it's bad. It's all circumstantial. Another way to say it is, if you were on trial, fat was on trial for causing heart disease, it would be found innocent because there's no high-level evidence to say that it really is a problem.
Absolutely.
So stay tuned. I hope there'll be lots of different ways to learn about the low-carb or ketogenic diet. And thanks for the work that you're doing.
Oh, no problem, Doc, no problem. And yeah, I mean, we just need to keep on pushing the way that we're pushing, just get the word out, provide the evidence, and people will change with the results, I suppose, really, more than anything. Yeah, that just leaves us one more thing to do, and that's to hear a smash it out from Dr. Eric Westman. So on 3, I'd like you to shout "smash it out" to the camera. So 1, 2, 3.
Smash it out.
Hey, there we go. That's fantastic. Fantastic. All right, Doc. Well, thank you again so much for your time today. Really, really appreciate you taking out the time from practicing at your clinic. And yeah, hopefully we'll get you back on the show when the next Clarity book is coming out, if there's going to be one, or when that project that you're talking about just there comes to fruition.
Okay, great.
Awesome. Take care, Doc.